My name is Nadje. I'm the current director of the Center for Middle East Studies here at Brown. I'm also professor of anthropology and Middle East studies. So one of the areas I'm hoping to focus on during my time directing the center is the centrality of gender and sexuality when trying to understand and analyze the Middle East, North Africa, and its diasporas. So I'm hoping to discuss different dimensions and issues with a gender lens to challenge the idea that gender is an afterthought or a footnote, but show that a gendered lens tells us a lot about the bigger picture. So the wider context for today's event is women across the globe being overrepresented in health services on the front line and in casual employment, most likely to be hit hard by economic downturns. Last summer, as I was researching an article on the impact of COVID-19 on women in the global south, it became obvious to me that we are experiencing a crisis that is showing us the value of care, but also the stark care inequalities experienced by different communities and individuals across the globe. Women who provide most of the unpaid care work within families are experiencing a sharp increase in their care burden. At the same time, women are disproportionately represented in the public sector and in informal economies, which have been shrinking during the various lockdowns that we've seen unfolding. The pandemic threatens to create long-term gaps in terms of girls' education, as well as women's participation in formal labor, which in turn risks strengthening traditional patriarchal gender norms and the division of labor within the household and the economy. Those women who still have jobs tend to do even more housework than before, feeling overburdened, stressed, less independent, and at the same time lonely and missing support networks and friends, but also extended families, has been a common threat for women across the globe. Now, the situation is particularly critical in the Middle East, where even prior to the pandemic, female labor force participation remained very low and stagnant. And this is despite the fact that girls were actually obtaining more in terms of education. And this phenomenon is known as the MENA paradox. Even if increases in participation are observed, they are typically in the form of rising unemployment rather than employment. And specifically in the context of the Middle East, we see that the contraction in public sector employment has not been matched by increases in opportunities in the private sector, which has led to increases in female unemployment. So this is kind of the background against which we've organized today's event. And it is my great pleasure to share today's discussion with my colleague here at Brown. Professor Banu Ozkazanc-Pan is Professor of Practice at the School of Engineering, and she is currently co-editor-in-chief of the journal Gender, Work and Organization. And the journal is today co-hosting the event with the Center for Middle East Studies. So Banu, over to you.
Thank you so much, Nadje. It's a pleasure to be here. And just as a little bit of a background on the journal to share with our audience, and I know some of you are very familiar attending. It was formed in 1994 to really be one of the first journals to look at the intersections of gender and work and organizations. And doing so, it allowed space for a multitude of critical gender research. And going forward with my colleague and co-editor-in-chief, Alison Pullen, we are really welcoming a turn to feminisms of various sorts, post-colonial, transnational, looking across the globe and in local context at the ways in which gender is an organizing principle for many facets of our society, including our economy. And we welcome submissions from all of you in this regard. what we noticed during the pandemic was, while many people were lamenting the fact that, journal submissions, particularly from women or women identifying individuals, was going down, we saw this as an opportunity to create a feminist archive of experiences related to the pandemic, and opened up a very brief call for papers. And we were overwhelmed with the number of submissions and sharing of experiences across the globe. And in creating that space, we saw that not only were there some shared experiences across the globe, but there were also some nuanced differences around context, geography, and historical context that we thought would be really, really important to address. And that was one of the inspirations for today's events, is to understand in the Middle East region, how is the pandemic playing out and how is it impacting women's opportunities and economic arrangements within that context. So without further ado, I want to introduce our first guest, Professor Charlotte Karam. She is the founding director of the Center of Inclusive Business and Leadership for Women, and a tenured associate professor at the Olayan School of Business at the American University of Beirut. She's a scholar activist who contributes to overlapping conversations in the business domains of ethics, human relations, responsible leadership, public policy, and engages in feminist praxis. Charlotte also serves as the area editor for the Journal of Business Ethics, and is a leading contributor and founding member of the Hadid Beirut, I hope I pronounced that correctly, which is an evidence-based, community-led movement of responders working to alleviate the humanitarian disaster caused by the August 4th explosion that hit the Lebanese capital of Beirut. So I wanted to welcome Charlotte to our conversation today, and I'll pass it off to Nadje to introduce our other panelists.
Yeah, great. Thank you very much, Banu. Yeah, I'm really excited to be able to introduce Hania Shokami. I've known Hania for a long time when I was living in Cairo. Hania is an Egyptian anthropologist, and her work has focused on gender, health, and social protection in Egypt. Hania has designed and piloted the cash transfers programs of the government of Egypt in her capacity as special advisor to the Minister of Social Solidarity. She's a proponent of feminist social protection and has lobbied for the right of women to receive welfare and pensions in their own right and not only as dependents. Hania was regional coordinator of the Pathways to Women Empowerment Research Consortium in partnership with the Institute of Development Studies at Sussex in the UK. And currently she is a member of the UNESCO Management of Social Transformations Committee. Hania has co-edited several volumes, one entitled Categories and Contexts, Anthropological and Historical Studies in Critical Demography, and the other one entitled Health and Identity in Egypt. Hania is currently Associate Research Professor at the Social Research Center of the AUC. Welcome, Hania. Thanks so much for joining us. And then I'm also really, really excited to be able to introduce Afaf, Dr. Afaf Jabiri, who again, I've known for quite a while, maybe not as long as Hania. So Afaf is a senior lecturer currently in the Department of Social Sciences at the University of East London. Her research focuses on gender in the Middle East, gender-based violence, forced migration and diaspora, and Palestinian refugees. Along with her academic career, Afaf is a feminist activist who has been advocating for gender equality and justice in the Arab region for the last 20 years. Welcome, Afaf. Okay, so we are now going to start with our discussion. And Banu, do you want to start with the first question? And I suggest that everyone keeps their cameras on now. And so we can, yeah, let's start the discussion.
Yeah, so thank you. Thank you so much, Nadje, and welcome again to our panelists. So our thinking is that we will spend about the first 45 minutes or up to an hour engaging with our panel discussions, and then open it up to our audience to hear their questions and thoughts on these matters. So we have a series of questions. We don't know if we'll get through them all, but we know that we will have some amazing insights from our panelists. And I'm going to start with a little bit of a bigger, broader question, and we will dig a little bit deeper as we move forward. And the first question is, how have you seen the impacts of COVID on women's employment in your respective context or country? And Hania, I will start with you and then move to Afaf and then Charlotte for this first question and hear your thoughts.
Right. Thank you, Banu. Thank you, Nadje, and thank you for the center. It's lovely to be with everyone, and I won't take up too much time. The effect has been profound in Egypt because 63% of the Egyptian economy, or the total employment, is informal. That means it's unprotected. That means that 63% of total employment, men and women, have no access to savings or health insurance or any of the kinds of things that made the COVID tolerable and manageable for the formally employed. And 90% of small and micro credit, enterprises is informal. And these are the enterprises that employ young women of all classes and older women, poor women. And so the profound loss that has happened at the economic level has been felt more by the people who are in these precarious work arrangements. Now, there are also demand side problems related to the pandemic. And we are actually lucky in Egypt to have a household income expenditure survey that was being fielded in February and that extended the data collection, which is the national survey, extended into March and April, and has some questions on the impact of COVID. And we see that women in particular were not only as expected to be affected because of this, it's like a wrecking ball that hit the informal economy, that was the pandemic, but there were also the effects of having to do with diminished incomes. We know that 43% of people borrowed to manage day-to-day life. They borrowed from unregulated lenders, so not from the formal sector, or sold assets. And the thing that hurts the most is to see the prevalence of rationing consumption. So actually people started eating less, spending less on their basic needs. I'll stop there.
Thank you so much. Afaf, I'll move to you. Afaf, you'll have to unmute.
Oh, I'm sorry. Yeah, I'm sorry. Thank you, Banu, again, and thank you, Nadje, for including me in this conversation. The full scope and effects of COVID-19 is yet to be revealed, although we know, as in similar conflicts and different types of crisis, COVID has so far and will have harder effects on women than on men. The public health system in Jordan, if I take it as an example, and the region as a whole has been weakened as a result of years of privatization of this sector in particularly. So the fear of the collapse of the already fragile public health system and its inability in responding to the crisis led government to declare emergency law, which, as we all know in the region, this is the unique expertise in terms of implementing martial laws and curfews. So basically, mainly measures included restriction on movements, closures of the borders, and as well as, and this has affected economic activities. Mostly all economic activities have been stopped unless for essentials. The health effects of the pandemic, which is one of its terrorizing nature, that it could be it could hit anyone, it could hit anywhere. And in the first wave of the pandemic, we can see that cities, in particular the capital Amman, which half of the population live in Amman, was most affected by the COVID-19. For example, rural areas and the camps were not first affected, and this has led some actually to assume that because of lack of hygiene, but this was not the issue. It was mainly because of the location, and that most of the Palestinian camps in Jordan, except those who are in the middle of the cities, are isolated from the population, and the interaction with the outside world is very limited. So although the health effects was on the cities, but you can see that if the economic effects of these measures more felt among those who work in the informal sector, service sectors, agriculture, and particularly among the poorest population, mainly migrant and refugee women. But in looking at some of the official numbers of the Jordanian National Department of Statistics, we can also see that we need to look at the impact in phases, not as general. For example, in the first phase, we see that men have been affected more than men. And if I can just read some of the numbers for you, the unemployment rate reached around the 24% in July, and an increase by 4.4 percentage for men and 1.4 percentage for women. But if you look at the numbers of the third period of the year, which is in December, we can see, and this is after the recovery, a little bit of the recovery of the economy, we can see that women have been hit more. So the unemployment rate has been increased by 6.1 percentage for female, around 5 percentage difference more than males. But if you look at the economic participation of women, we can see that actually it has been increased in 2020. In 2013, it was around 13%. And of course, the employment rate for women in Jordan is the lowest one of the lowest in the region. But this increase can be explained in terms of the types of jobs women are concentrated in. Women comprise around 69% of the health and education, and those are the two sectors that haven't been hit hard by COVID-19. And also after the recovery, there has been more recruitment of women in the health sector in general, not only as nurses and doctors, but also for other key essential work in the hospitals. And we can see there are also differences between how women who work in the public sector and women who work in the private sector in relation to the government measures. While the government has protected all people who work in the public sector, the protection for those who work in the private sectors was much less. So women comprise around 51% of the public sector, which means that those were more protected than others. Of course, these are the official numbers, but in terms of the informal sector, the situation has been much worse, particularly because also government did not issue any protection measures for workers in the informal sector. And women comprise, as we know, also the vast majority of the informal sector in Jordan. It's around 60%. Most of them work in agriculture, services, and manufacturing. And those women, as Nadje in her introduction stated, they do lack any security protection or social protection, which basically work on daily wages. There has been no measures to protect them, completely left out of all protection measures. We can see also Palestinian and Syrian refugees and Egyptian workers in the informal sector have been also hit very hard in terms of, particularly when it comes to women employment of these categories of people. I just want to give, I will end, but I want to give an example of how, in terms of when the pandemic is entangled with a situation of occupation and under settler colonialism in Palestine, how the situation could be even sharper and much harder. As we know, in Palestine, things didn't start with COVID, but it started with the deal of the century. And this deal of the so-called deal of the century. And of course, during the pandemic, the occupation forces and the United States used the pandemic, COVID test, health aid, and everything in order to pressurize the Palestinian Authority to accept the deal. And right now, actually, the vaccine is also used. If you look at the numbers of the official numbers of unemployment in Palestine is very alarming. You can see that it has been doubled in Palestine in July. It was 28 in 2019. It's now 43%, which is almost the double. And you can see also the difference between the West Bank and Gaza. In the West Bank, it's 29. In Gaza, it's 70% because of the blockade and also the pandemic. And I will stop here. Thank you.
Thank you, Afaf. It's quite troubling across very, very different scenarios, and we'll, I know, get into some of that. Charlotte, I'll move on to you.
Thank you very much, and thank you for the invitation, Nadje and Banu, and Afaf and Hania. Thank you for sharing. So I'm going to speak specifically to Lebanon. So Lebanon, as most of you know, is a tiny country, 6.7 million people, 1.4 million refugees and asylum seekers largely from Palestine, Iraq, and Syria. So we have recorded over 280,000 corona cases to date, and more than 2,400 deaths. And definitely the impact of COVID has been devastating for women's employment in Lebanon. And in fact, what the pandemic is doing is just amplifying the gender gap that we have seen on all fronts and intensifying the gender inequality. However, I really think that to reflect on the pandemic in isolation as if it were a vacuum is really impossible across the region, and perhaps particularly now, 2019-20 in Lebanon. So this is, of course, not to ignore or minimize the devastating impact of COVID, but in the case of Lebanon, COVID-19 is a catalyst and has been a catalyst that just accelerated the decline of the country that's been plagued by layers of toxic crisis. So life in Lebanon was already unbearable, plagued by high unemployment, which is disproportionately female, a highly informalized labor force, which is also disproportionately female, an accelerating economic downturn, and eventual 2019 complete economic collapse with the closing of the banking system. This affected everyone. So by the end of 2020, the Lebanese pound was selling at a rate of 8,000 lira to the US dollar for $1, which in effect losing 80% of its value over the previous year, 80%. So most Lebanese earn their salary in local currency and earn now 20% of what they were earning in 2018. So for the privileged class, such as most of us here, academic class, you are making 20% of your salary, and Lebanon is reeling from this economic impact. But if you really think about the majority of the Lebanese and non-Lebanese, or the inhabitants of Lebanon, those who are not so privileged, there is a huge effect. Millions of people have suffered a devastating effective reduction of their incomes with little or no social protection. Over the last 2 years, specifically, Lebanon has experienced its worst economic crisis in history. Does not compare to the Civil War, the 15 years of Civil War. Estimates from the IMF place Lebanon as the third highest indebted country in the world in terms of the ratio of debt to GDP, with very little hope of the country being able to repay its debts, and little hope of securing vital bailouts that are constantly coming up on the news due to specifically international trust issues with the corrupt and entrenched political class that is our current government. The country's central bank has accumulated over $49 billion US dollars, which equates to 91% of Lebanon's total economic output in 2019. So the years of austerity that were promoted by repeated loans, IMF loan conditions, and policy advice have led to further, as both my colleagues have mentioned today, further erosion of social protection systems in Lebanon. So there's decades of evidence of failing, discriminatory, inept state structures infested by a privileged, corrupt political class that refuses really to let go of power, has pushed millions to gather in the streets, as we saw in 2019 with the October Revolution, which was led by women through their social mobilizing and their political mobilizing. They took to the streets calling for change. This was a very beautiful time for women in terms of organizing, in terms of hope. But then COVID came and it reared its head. And here, the vulnerability of people, especially the women and other vulnerable groups, were heightened. The gender inequality and injustice became clearer and clearer because of the pandemic. The pandemic just made everything worse. And though at first the medical professionals were doing well, and if you recall, Lebanon had one of the lowest rates of infection and death within the first few months. This was hailed as a very surprising accomplishment, probably because many of the private hospitals and hospitals that function on charity donations were leading the way, not the government. But then August 4th happened, the Beirut blast, and everything spiraled even more out of control. One of the biggest, as some of you, I'm sure most of you are familiar, it was one of the biggest non-nuclear explosions in history, the result of an accidental detonation of approximately 2,750 tons of improperly stored ammonium nitrate at the government port in Beirut. Again, an example of inept government. The blast led to over 200 deaths, as well as 6,000 industries and 300,000 displaced. So in the aftermath of the explosion, the pandemic gained its momentum. So the death and the devastation and the volunteers removing bodies and rubble and glass from the streets, crowds at hospitals, 5 hospitals being destroyed in the center of its capital. The health, safety, and precautions around COVID, went out the window. This, along with the global spike in COVID cases, caused the pandemic and level to really spiral out of control. So today we're 6 months and a bit from the blast. The entire country is still suffering. We've never seen or experienced such a time. On paper, Lebanon's COVID restrictions are among the strictest in the world, but in reality, it's the grinding poverty is pushing many back into the streets to seek out their living. I'll just end by saying that the World Bank estimates that the portion of Lebanon's population that is now below the poverty line has risen from 30% to 50% just this year. Over the past year, the cost of food has gone up 420%. People have lost their jobs, again, disproportionately women, and many can no longer afford to feed their families. So it's only in this context, I think, we can understand the impact of COVID on women's employment. And by all accounts, it's devastating.
Well, thank you very much, Charlotte, Afaf, and Hania for this, first round of answers. I mean, I think it's a really important point, the point that we cannot look at the situation just by focusing on the impact of the pandemic. Clearly, we need to historicize, we need to put into a context, and almost any country in the region, we will see a multiplicity of overlapping crises. So we don't have anyone, for example, today to speak specifically to Iraq, but you couldn't speak about the impact of the pandemic on women's employment without speaking about the impact of war, occupation, and also obviously authoritarianism and sectarianism. So there are so many different intersecting configurations and crises. I'm wondering, so we kind of tried to start, as Banu was saying, start out broadly and asked you about women, but I'd like you to sort of reflect a bit more specifically about the way that women are not just a uniform category, and clearly different women have been affected differently, as we know that even pre-pandemic, there were intersecting inequalities in terms of gender, ethnicity, religion, and so on. And so I was wondering if you could reflect on those intersecting inequalities. And Hania, if you would start again, please.
I'm not going to talk about intersectionality in terms of ethnicity or class, but I would like to talk a little bit about the loss of public space, the loss of public services, and the loss of public sphere insofar as it relates to women's risk of violence. Now, Egypt has a problem of gender-based violence. In 2014, the last Egypt Demographic Health Survey, because we haven't had one since 2014, found that 3 out of every 10 women had experienced spousal violence. So we're not talking about other forms of violence, brothers and mothers-in-law and neighbors and so on. And in a more recent study, which I was a part of, we found that 70% of men and women, this was a study that was conducted in 2017, 70% of a national sample thought that women should accept violence. They should accept because in the name of keeping the family together. Now, the pandemic has hit the worst women who found some form of welfare, some form of network, some form of friendship in public spaces and public services. So including schools. I mean, I think any of us, luckily my two are grown up, but people who have had to homeschool their children, women who have had to find internet connections and beg for laptops or tablets, or because the government distributed ones were not enough, to put up with the pressures of spouses being at home. It's never pleasant for anyone, I think, if your partner is at home all the time, but it's particularly bad for violent partners. And we have the National Council for Women actually, although it's a government body, has set up a violence observatory. And in the first month of the pandemic, there were over 134,000 complaints. So they could be queries or complaints. It's difficult to, but there was a spike in women reaching out to the council. We know that there was 7% of through a phone poll, a large phone poll. 7% of women said that in the first few weeks of the pandemic, they experienced violence that they had not experienced before at the hand of a spouse. So I think what this tells us is that we as observers and analysts and scholars have really not looked enough at public welfare and public space. And that when it's lost, because of social distancing, because of the shelter-in-place orders, you know, that it's a flag for feminists and for researchers to begin to look at how different types of women had connections, had somehow derived support. So it's a feminist principle that feminists often forget, and that is the hegemony of the idea of civil society as an organized thing has meant that we look at collective action and collectives as organized civil society space. This pandemic has shown us that meeting on the streets and talking to parents at schools and being able to access markets and being able to shelter in someone's home when you're being beaten up, that many millions of women in Egypt have experienced have become victims of this loss of collective public space. And I think that's something that we should be looking at and studying. I'll stop here.
Yeah, thank you very much, Hania. That is a very important point, and something that again sort of plays out differently in different contexts. And we recently had a discussion here as well to look at feminist mobilization in the context of COVID-19 in the Middle East and Latin America. And one common thread was that of gender-based violence and the increase of gender-based violence. Thank you. So Afaf, would you like to reply now?
Yeah. Yeah, of course, the issue of intersectionality and is important in the time of the pandemic. But I will start first by saying that it's quite evident in feminist economist work, some work of Sylvia Walby on crisis or Naomi Klein on the doctrine, shock that all shocks to economy are usually turned into opportunity for corporate companies and for capitalistic global governance. So crisis that we are going through right now in the pandemic, the fear is that these crises are to be turned into opportunities to put more conditions, ask for more deregulation, privatization, and austerity measures. And all these measures are not only gendered. but also class, race, and ethnicity dependent. And from the start of the pandemic, it has been quite clear, for example, the ability to self-isolate or work from home. These are privileges, and privileges not everybody could afford equally, if at all, for some people to engage, to enjoy this privilege. So despite the spread of the pandemic and in the exception when there were emergency rules, women, particularly migrant women and migrant men who work on daily wages, continue to go to work without any protection or safety measures. I'll give one example of how the Jordan defense measures were not only gendered, but also racialized and based on racial and gender discrimination. In March 2026 of March, Jordan announced Defense Order number 3, tightening curfew restriction to control the spread, to control the spread of the pandemic. But in the beginning of April, on the 4th of April, which is around a week after the lockdown, the government permitted employers at the industrial cities in Amman and gave them the permission to reopen, but they will be reopened only for migrant workers. Jordanian who were not working and who are working in the industrial cities were exempted, and their wages were protected, but migrant workers, particularly from India and Bangladesh and these places are basically female and migrant workers places. So this is a very clear discrimination between migrant and migrant, and also, as we know, these places are mostly, predominantly, these jobs kind of is done by women. And it's also important to remember that the industrial cities in Amman, there are 4 industrial cities in Jordan. These industrial cities were established in agreement with the United States in the 90s, based on duty-free and trade-free agreement, and so the impact of this corporation and the adoption of this type of the economy in Jordan was clear in these kinds of racialized orders. Another defense order issued enable employers at the industrial zones, particularly to stop paying. They enabled the employers to stop paying salaries for workers who are not working, only migrant workers, but not Jordanians, which forced many foreign migrants who wanted to leave the country to stay and actually not be able to leave or to go even home. This has resulted in a huge number of cases of infection in the industrial zones, which is basically just in September, 600 cases on one day on one garment factory in an area called Adlil industrial zone, and this has been repeated 3 times after this accident, with very little attention from civil society groups and also from the government. There's a second example of how also homeschooling, which Hania has referred to, is important, but also it will increase disparity in education in Jordan at the long term in terms of the opportunity and access to labor markets based on class and also geographical distribution and in the country as a whole. So access to online education has been merely for students enrolled in private schools. In Jordan, if you have extra 100 GD over your basic needs, you don't send your children to public schools. You mainly do whatever it takes to send them to private schools. So most of the families and those in private schools were privileged to have private schools immediately established the online learning and digital learning, and they carried out as in other countries. But students who are enrolled in public schools, they did not have the same equal opportunity, and this has to do also with the digital gap in the country in general. If you look, for example, in the situation of the camps, most people do not have laptops. The whole family does not have a laptop. people mainly use their mobile phones to access, and the mobile data to access. They didn't have a broadband. But the interesting thing in terms of the homeschooling, the emergence of new the emergence of a new market for the private lessons. We have seen, for example, in the camps in particular, because Palestinian refugees wanted their kids, but those who are wanted to give their education for girls or boys, those who are at the last year of the high school, which is called tawjihi. So there is an emergence of a business by telecommunication corporate companies, prepaid private lessons. So you pay a card and you top it up as needed. And if this card, if you don't have any more credits, your lesson will be cut. This is a business for corporate companies, and they have used it. So imagine if you want to give your son or daughter 9 subjects, every lesson costs between 50 to 100 per term, which means 1,000, and this is a huge amount of money for people. In terms of Syrian refugees in Jordan, and according to UNHCR survey, we can see also another layer of discrimination. 40% of Syrian who had permanent work permits in Jordan have lost their jobs completely. And this loss is basically because of discrimination in terms of job opportunities. Syrian are only restricted or can have jobs in the services, construction, and agriculture sectors. The issue in relation to gender-based violence maybe, but I will mention it here in relation to domestic workers, particularly migrant workers, domestic workers, which is an issue in Jordan and Lebanon and maybe the Gulf states. But I usually look at the data of Jordanian women's unions. They have the biggest hotline, and they have different centers all over the country, and usually they receive cases of migrant workers referred to them by the police. And I was comparing between numbers in 2019 and numbers in 2020. The number of domestic workers decreased sharply, and this means that access to justice, access to the police, and access to and escape violence that is they are exposed to was harder for migrant women than Jordanian women. It was clear that there been the number of Jordanian women increased in terms of the calls, but the number of migrant women decreased. Also cases of trafficking, there was no cases of trafficking that usually Jordanian Women's Union deal with, but this is because they deal with it through the Department of Criminal Affairs Department. So the access of migrant workers generally to the services to escape violence has been very limited, and I'll stop here.
Thank you, Afaf. Yeah, I mean, the issue of domestic migrant labor is, of course, very key. And I assume, Charlotte, it also features in your reply. So over to you now. Just before, maybe just wanted to remind the audience, if you would like to ask a question or make a comment, please put it in the Q&A function. Okay, so Charlotte.
I mean, I very, very much resonated with what Afaf and Hania said, so I won't repeat, but I will just add perhaps a little bit, as Nadje just said, on migrant workers. Afaf spoke a lot about industrial zone migrant workers and also the case of refugees, which has been covered, so I won't repeat, but I'd like to just draw a little more light to migrant domestic workers, as Nadje just said. The COVID pandemic has certainly put migrant domestic workers at greater risk for exploitation. In the case of Lebanon, we have something called the kafala system, however you want to pronounce it, which in many people's estimations is a modern form of slavery with very little rights. Migrants and refugees have almost no labor protection even before the pandemic, and now really are left completely exposed. And current systems do not provide labor or social protection in any form. And so when COVID hit, it basically exacerbated this already very, very oppressive conditions, with more employers at home because of the confinement, you have these individuals, these women carrying disproportionate amounts of workload, longer working hours. You know, some of the narrative stories coming from women or you know, projects documenting, they're really quite horrendous. We've seen a spike in suicides of migrant domestic workers during the lockdown. We have also increasing reports of employers actually withholding pay or significantly decreasing pay. You know, with part of the correlation there that they're now at 30% of the employer's salary, and therefore, you know, it's having these horrible spillover effects on the more vulnerable communities. Some migrant domestic workers have reported being laid off by their employers and not having anywhere to go, not being able to leave the country because of closing of the airport. Freelance workers who, you know, use this income to support their family are no longer being hired or having jobs. You know, houses that they've cleaned for 20 years and 30 years, this is no longer happening. Institutions, businesses, universities that would hire labor in this way no longer are happening. So there are also, the final thing I'll say, it's very important in the context of Lebanon, and I believe in Jordan and a few other countries in the region, that there are a significant number of migrant women workers, specifically in the agricultural sector, who are also not protected by the labor law. And the conditions there are poor and unregulated. So this really indicates that women have been bearing disproportionately high burden, particularly these vulnerable women from lower down on the socioeconomic status, something we should be very aware of. Thank you.
Thank you.
Thank you to all three panelists for addressing these questions. And I think, you know, I mentioned this as well as Nadje. If you have questions for our panelists, please do share them so we can engage you as the audience. One of the questions that we wanted to have all of you sort of think about is, you know, in the midst of the pandemic and these ongoing gendered impacts, are there groups that are mobilizing to address these impacts, to kind of work against them within your context? And if you could share examples, that would be fantastic. So, you know, Charlotte, why don't we start with you and then, you know, open it up to dialogue between all three of you.
Okay, it sounds great. So Lebanon historically has been very much a very heavily dominated CSO or civil society context, where you see quite a bit of mobilizing between different CSOs, highly funded by international INGOs. So the idea of groups mobilizing formally and informally is quite, I think, second nature to in the Lebanese context. So I could speak of many examples that responded to COVID and on the back of everything else I described before. But I want to highlight one in particular that I'm involved in. It's a grassroots initiative called Khadet Beirut, which you mentioned and you pronounced very well when you were doing the bio. So Khadet Beirut is it aims to co-build local alternatives and best practices for growth opportunities and try to centralize within it a feminist methodology and a notion of well-being and dignity for the inhabitants of Lebanon. We chose the word inhabitants very specifically because we didn't want to say citizens or Lebanese. We mean everybody who inhabits the land. And this is a grassroots initiative that puts at its center an evidence-based, so data is very important in the region. In order for us to strategize better, we need to collect data. So evidence is very important. We work on 4 specific areas in community health, education, environmental health, and local businesses. So around the idea of organizing for health, because we're talking about COVID, this Khadet Beirut emerged on August 7th, the day after the explosion, and we have a wonderful health initiative that developed very specific things in the wake of COVID. One is a COVID triage guidebook. They've established training programs for local nurses and doctors across the country. They've developed a framework for COVID task force units. They've actually established in partnership a hospital in one of the main areas that was impacted by the blast. It's called it's the hospital within the Karantina area. And they partner, they're building a model to promote a delocalized health management system, particularly targeting underprivileged areas. And this is important because the centralized response from the government has not been responding in the way that it should. And so this type of organizing is really the way people are experiencing relief or working for relief, taking the responsibility in the hands of the people. And I think this is, I'll just repeat and stop, but this has really been the case in Lebanon for a very long time. It is challenging because there is a lack of funding, an inability to transfer funds from outside the country inside because the banking system has collapsed, but still, to the credit of the people in Lebanon, they're still organizing in this way.
I just wanted to maybe to start a dialogue and say, this is a pandemic, and the pandemic really undermines the idea of the local and the regional and the national. And so the way, you know, it's difficult for civil society and individuals to do more than what they usually do, which is respond to crises, try to try to provide services or try to provide awareness. But this is really a unique time. This is a global pandemic, as we all know. We've all been living through it. And one of the issues that we've all been living through is this really fake notion that the world is a small place and that we care about what's happening in Brazil and they care about us, or, you know, that we get very angry with what's happening in Texas, whereas the governor of New York is great. All of these things mean nothing to us, actually, but we become very emotive about things that are on the other side of the world. So, you know, yes, civil society has been distributing food, or National Council for Women setting up an observatory for violence, or Ministry of Work and private industries and so on have been trying to mount some modicum of social protection programs, or absorbing part of people's salary and so on. But these are, I don't think that all of this is rooted in us, in anything that is, I think, that has kind of long continuity or sustainability. We are just reacting to the fact that now we know what's happening everywhere else in the world, and governments are now embarrassed by how, you know, they didn't order vaccines when they should have, and now we're all conscious of these things. So although, yes, there's stuff happening in Egypt, but in the sense of this stuff being Egyptian or rooted in some kind of resistance or participation or social transformation, I don't think so. I think we need to just remember that we talk, eat, breathe, smell, everything about the pandemic, and we think that the world is smaller and that what happens somewhere else should happen in our countries, and that is really not the case.
No, I think the pandemic, because of the post-revolution context, and because of in different Arab countries there were different, maybe this is the first time that where you don't see many coalitions or alliances of women are working together, particularly the last few years before the pandemic. But I've noticed the pandemic has brought women again together through Zoom webinars. There were so many discussions around even issues related to employment, issues related to gender-based violence, and issues related to how they can face the pandemic together as women. And some particularly activists in Egypt who were restricted, for example, from leaving the country, was a positive. This is a positive for them to stay connected through these webinars. Some women in Yemen, in Iraq, in Libya, also because of the conflict, and in Palestine, there were already restrictions to their movement. So these webinars open up some sort of a new collaboration. And I think also civil society organizations, their use of the social media and campaigning and advocacy through social media has increased through the pandemic, and they are now more capable of kind of using. And I think there were some cases in Jordan particularly were very interesting in the case. But in terms of the response to the pandemic itself at the local level, from my work and experience with the Jordanian Women's Union, the government was unable to respond immediately to the immediate needs of the pandemic in terms of women. Actually, where women's group who, for example, the government has a very big shelter for women, but they have bureaucratic arrangements for women to get into the shelter. It was easier for the government to send women to the Jordanian Women's Union shelter and to the helpline and services instead of them, for example, taking place. So you see women work at the grassroots, also at the grassroots in terms of awareness raising, because there was because of the mistrust generally between people and the government, usually people do not take anything seriously from the government. And that led to some people thinking about the pandemic as a conspiracy, for example, and for so many other reasons. Some I don't blame, because of course, but so women's NGOs played really a very good role in terms of awareness raising in terms of the pandemic. But also the pandemic, again, if we want to contextualize it, we don't think that mobilization around conflict have also showed some activist crisis, because the issue of women's employment and economic participation have been left out for decades, which was the issue for advocacy and work before 1990s. But since 1990s, with all the challenges we know about the NGOs' work and also their inability to find solutions with NGOs' laws that restrict them to work on politics and work on issues related to the economy in general, with funding also that gives some areas some more priorities than others. For example, priority areas are more into the private, which are issues related to gender-based violence, issues related to personal status laws or family laws. So women's employment and economic participation in general was very limited to advocacy related to kind of pension, advocacy related to sexual violence within the workplace, but not tackling the structural, systematic inequality within each countries. And this has been left out for women's NGOs for a while, for the reasons I've mentioned before, in terms of funding and in terms of government restrictions. So there are many things that we need to look at when we think about NGOs' response and local groups. But if you look at the camps, and this is the last point, because Palestinians are quite experienced when it comes to dealing with the crisis. There were immediately locally groups, including women groups, were organized, and the camp was divided into several areas, and every group was trying to do something in that, in terms of self-isolation, quarantine. So they have managed themselves by themselves in that time. And I didn't hear.
Can I just react to something?
Right.
When Nadje was speaking, I didn't recognize myself or the case of Lebanon. And when Afaf, I think I felt more akin to what you were saying. The fast mobilizing of CSOs, organic, not formal, or even formal. But I'm talking what happened immediately, and it happened quickly, and it brought food and donations of blood and medicine, immediate relief to, and we're talking about hundreds of CSOs. And without it, it would have been much worse. And the reason they could mobilize so quickly is because it is on the back of the revolution. They were organizing a month before, they were organizing the revolution. And then COVID happened and the economic collapse happened. So you already had your networks of trusted people. And if it wasn't for the CSO communities, the activist communities in Lebanon, it would be a much worse place right now. It's because of organizing. I feel very strongly about that. Building hospitals, bringing computers to school, education. I didn't talk to you about the SMEs. Rebuild. I mean, they're rebuilt. We rebuilt within 2 months 120 SMEs in the downtown area, in the area of the blast. This is the organizing that's happening. It's not the government. It's the people. It's the CSOs that are organizing.
Yeah, I think, Charlotte, there's a difference between Lebanon and Egypt, and we have constraints on civil society, although luckily the law now has changed, and that's opened up a lot of frontiers, and it's hopeful. But what I mean is that this is what Egyptian CSOs and I guess have been doing anyway. I mean, you know, whether it's a matter of pace or scope or scale, but fundamentally CSOs and I mean civil society organizations, collectives, and so on have not done anything that they haven't been doing before. We've had great groups. Someone was just reminding me who were delivering medications to people's homes. I mean, we can, yes, this does happen, but what does it mean? You see, that's what I'm saying. What does it mean? What does it point to? The fact is that there is a pandemic, and it's a global pandemic, and airports were closed, and we have all felt this, we're all living in it. So that organizing, which happened with the devaluation, and which happened with the revolution, and which happened with all sorts of catastrophes that happen all the time, and good things like our revolutions too. But what does it mean? I can't see
something very specific to me. It's alternative mobilizing for alternative systems, right? We need something new. This is what it means. We're creating policies and practices and strategies for new healthcare, for new governance. I mean, this is what it means. It means the future. We can't.
And even in the same country, if I may just, even in the same country, because the impacts were quite different. If you look at the rural and the cities and the camps, so the type of response actually was quite different, that we need to look at it and how women have responded. So organizing in the camps, because there is no way people can self-isolate in the camps. They live in multi-generational, they live in the same house. Like the house is the grandparents, the parents, the children, and the neighbors, and everybody. So in order for people to kind of find ways in which they can use, for example, this is one of the ways some groups were working, that how to really use the space that we have in a way that we can, like how to organize the street itself in social distancing. There was a campaign which was really fantastic, because Jordanian election took place during the pandemic. So despite the lockdown and everything, but election was important, the parliament election, so that was quite something. Anyway, so there a group of people asked the candidates, instead of making brochures and dinners and lunches, just to have this fund for those who need, who was in very hardship in the camps. And they have actually pressurized them and pushed them until they have had that kind of some amount of money that they could support people in the camp. And that was informal group of, it was not a local formal organization, but just a group of youth who thought that we need to do something. I think in rural areas, there was another way of which mobilization took place. So we don't only, and the impact, for example, of gender-based violence is quite different, because in the camp, when you live with all of these people together, the beating and violence could be actually less, because they are around all the time. And in the rural areas is the same. You can see, for example, I've now engaged in an action-oriented research in relation to economic context and politics and gender-based violence. And as we are getting the surveys, some of the comments, which could be something, I don't know, maybe positive, that some of the women's comments that would do in terms of recommendation. One woman said that if you can get just rid of all men, another one said, like, just tell the government to make a segregated lockdown where they can take all men and make them live together, then they would understand how do we feel. There were some kind of very radical comments from women. And then when I looked at where these comments are from, they are from the cities, because those women have been confined with their husbands for a long time. But these same comments didn't come from other places. So I mean, mobilization, even in the same country, did not take the same, or still not taking the same, because of different needs and different contexts and different privileges, and also discrimination.
Thank you. I mean, it's a fascinating discussion. We could go on, but I'm very conscious of the fact that we have lots of questions coming in. So what I'm going to do is I'm going to read out 2 or 3 questions, And then, I'm going to hand over back to you, and don't have to feel that you have to answer all of them. It would be great if we had 2 rounds of questions because we have quite a number. So the first question is by Amal Abdelatif, who thanks everyone for the great and interesting insights. I was wondering if there's a potential for creating a shared collective feminist space as means of harnessing transnational mobilization in the Middle East to tackle the pandemic amplified gendered, classed, and racialized inequalities. Also, how does the current unprecedented circumstances hold a threat on women's career progress and their representation in top ranks in the next 5 to 10 years, and what should be done to mitigate this impact? Another question from Elizabeth Villa-Gomez. It seems that one of the largest contradictions of the region, which is the largest influx of foreign domestic workers and the lowest activity rate of women in the world, has come to a head. Can the COVID situation be an opportunity to address this paradox? Care has been central to the survival of families worldwide. How can we use this to push governments in the region for change? And I'm going to read out one more question by colleague Said Achan. Hello, Said. Thank you all for this tremendously important panel and for your invaluable work. My understanding is that women are highly represented in higher education institutions in the MENA region, but this doesn't translate to employment in robust ways. Is the pandemic impacting this higher education landscape as well? And are there efforts to bridge the gaps from education to employment? Okay, so Hania, would you like to kick us off?
Oh, okay, I'll start with the third question, just to say that yes, higher education is overwhelmed by women, but no one's getting an education these days. So I don't think, I think we'll have to forego these couple of years in terms of education. However, on a more serious note, the problem with employment in at least in my country and in our part of the world, is a problem of endemic structural malfunctions of labor markets. And it's economies that are not producing work at the rate that they're producing educated people. And therefore, the problem I think that we need to address really is how to bridge that gap and what are the policies that are needed to bridge that gap. So we're seeing the failure to produce work, particularly for educated people. So obviously there's something wrong with the education and there's something wrong with the jobs. And I'll connect it to the second question about opportunities and care work to say that really, yes, we do, as Amal said, need transnational, regional feminist networks to come up with an alternative gender agenda. Our concepts and our tools and the foci of our work are just old. They are no longer relevant. So care work very soon is going to be about caring for the elderly, not caring for small children. And economies are just going to stop producing jobs altogether. So even issues like automation and AI and poverty, which is reducing people's consumption, are just affecting the quality of work. What we're going to have a future of low pay, precariat work. We're going to look at a future where care work, as I was saying, is about the elderly, not the young. We're going to be looking at a future where the feminist collectives and scholars really have to come up with a new agenda and just get their heads out of the stale dialogues that sometimes happen. Having said that, I think that there's a lot of interest in, for example, I'll just give one example, in looking at social protection for working people rather than social protection for the poor or social protection for the unemployed or for the destitute, to begin to think about ways to bridge that gap between education and employment, to bridge the gap between women's productive and reproductive roles, through innovative modes of social protection. And I'll stop here.
Great, thanks, Hania. Charlotte, would you mind trying to keep it to 2-3 minutes so that we can have another round?
I couldn't agree more with what Hania said around the transnational mobilizing. I love the question. Thank you very much. And just really quickly about, this whole idea of the feminist bailout from AWID, the Association of Women's Rights and Development, very much I think is aligned with what Hania is saying, needing to simply shift the current mindsets and the way we think about current resources and what matters, like well-being and care, bringing that part of the way we think about economics and we think about production, bringing reproduction into production. So I couldn't agree more. I won't repeat, but I will say something that might be unpopular, but I will say it anyway. I believe, and partly because of my bias being in a business school, that waiting for the government alone, government-led or international community-led responses to COVID and to crisis is not enough, and we have to have all hands on deck, and that includes private sector, and that includes employers. And the two questions that came from the audience or the people joining us here today, I think are extremely important. We need to do more in engaging organizations. And when I talk about organizations in our region, I'm talking about family-led businesses, which is the majority of our economies. I'm not talking about multinational organizations. Family-led SMEs, small to medium-sized enterprises, primarily middle-sized enterprises, to begin to try to engage with them on a feminist agenda to think about policy change and policy implementation. I'll put a plug for a project that we're doing now. We are building a transnational network of employers across 11 countries in the Middle East and North Africa, and this is specifically what we are trying to do. And I think that it's a small way forward. It doesn't excuse the government from what they need to be doing, but we need all hands on deck, and private sector is an extremely important one, specifically around the questions asked by the audience around employment and transition of employment.
Yeah, I mean, that is, I guess, we could have a whole session around the issue of private sector, and especially in the context where, I said in the introductory remarks, the Middle East is a region where women have historically been disproportionately represented in the public sector and affected by the decline of public sector jobs. So yeah, so Afaf, over to you again. If you just keep it really short so that we can have another round.
Yeah, I'll try. Just on the question of transnational feminists, I think this is very important right now, particularly feminist agenda, feminist economist and financial agenda. This is very vital and very important. And feminist agenda that would look at how really to connect different contexts in the world that we are all suffering, and the pandemic is quite an opportunity for us to look at how we have all been impacted by the global capitalist system and neoliberal policies. And I'm sorry, Charlotte, that I would disagree with you, because I think it's important for feminists to think about the household economies and also issues related to the public. And I just give very small examples of the neighbor I was living in Baqa camp in the 80s, and how everybody was productive, and I don't think that anybody was poor, because the whole neighborhood was quite a business kind of neighborhood, where we used to get the milk from Naif, the yogurt from Mahmoud, the eggs from another, and all these households have produced engineers, doctors, nurses, and different men and women. Of course, men are more than women, but also in the beginning of the 90s, when the government of Jordan invested more in the public sector and made those trade agreements, free trade agreements, cheaper products flooded the markets, and all these businesses of women were closed, completely closed, and people pushed into poverty. The camps and rural areas and poorer areas in the Jordan were not the same. So I would disagree with the investment of the public sector, because it has always been at the expense of public sector. And when there is cuts to the public sector, sector, it comes at the expense of women, as Nadje said. And this is important for feminists actually to start this discussion, and where we are going and having a clear agenda of how we want to start mobilization. Maybe a feminist, a transnational feminist, could help in the ways in which, as I said previously, women are banned from talking about politics and economies, formal, I mean, NGOs, particularly by law, they are not supposed. And if you want to tackle issues related to contestation and collaboration between authoritarian regimes and neoliberal projects, you have to get in politics. And without getting into these issues related to economic participation of women and employment would not be addressed, and then it would not be, we would not be trying to find the real solution for them. Sorry if I was long.
Thank you so much. I know we are close to time, believe it or not. We only have 13 minutes left. So I wanted to go through maybe another 3 questions that our audience has shared with us, and again, get your thoughts on maybe at least one of them. Rafia Faiz says, thank you for a great session. Any practical advice on what women with limited resources and underprivileged positions and contexts can do to better cope with multiple forms of violence and inequalities in this pandemic? What can we do as individuals? Another point from Ozkazanc is, thank you for such a great webinar. Are there specific numbers about the effect of COVID on women in Lebanon, such as employment, unemployment rate, violence, and others? Another question I'd like to kind of share is, what do you think we as feminist academic activists should be doing differently to push the gender agenda forward in our research and classroom during the pandemic? Could the pandemic give us more legitimate platforms, in your opinions? So I'll leave those 3 questions for you each to address, even though one is very specific to Lebanon.
Maybe I could just start with Lebanon and get that out of the way. There's actually quite a bit of, grassroots sort of research and evidence and sort of documentation that's happening, and also some done by INGOs. There's a Legal Agenda is an organization within Lebanon that is tracking these numbers and tracking various statistics. So that might be a website that you could look at. And also the UN Women, in partnership with the National Commission and I think WHO, they come up with the Gender Alert on COVID-19 in Lebanon. It's a monthly newsletter, and it is fantastic with lots of very specific numbers, an intersectional lens of looking at the context of Lebanon. So I hope that's helpful.
I can talk about the practical advice and what feminists can do. I think my answer is the same for both. It's to get back into grounded field research and communication with an open lens, because the world really is changing. And unfortunately, I mean, academics are great, but there's always a time lag. So, by the time the state of the art has a wisdom, the world has shifted. And so I think that practical advice to feminists is re-engage with what women are doing, even re-engage with what woman means, because I think even as bodies, as agents, women are changing, different desires, different practices. For example, in Egypt, we've been, unfortunately, even feminists were shocked by recent cases of gender-based violence, rapes, group rapes of young privileged women that brought up the idea of what is consent, because some of these girls did not get justice because by being at a party or by having a relationship, this was seen as consent. So, for example, the notion of consent is important, as we see a lot of home-based violence happening around sexual aggression. So that, I think let's get back to our groups and our grounds, as Charlotte has done with Khadd Beirut. It's a great initiative, and this mobilization of AUB professors and other professionals to sort of engage with a ground level problem. In terms of practical advice, I think that women do need each other. We just have not stressed enough the idea of collective action that is not based on membership in an organization, like we're all part of an NGO or a feminist movement, that is about common membership in daily life. And that just rediscovering these, not to call it social capital as the World Bank would do, or that, I mean, trivializing it as a sort of in-kind exchange, but really to think, to see how women are relating to each other. And COVID has really shown that, because when we go, and that's my last point, whether homeschooling and relying on other people to be there, you know, the numbers of women that, according to one study, that have just had to go back to work and leave their kids with the TV on and something in the fridge, and that, you know, relying on a neighbor or a neighborhood. I think just rediscovering some of these issues about how people are coping, how people are adapting, how people are taking control of a difficult situation. I think that would be good for all of us, particularly as academics. Thank you.
Yeah, I agree with Tanya. I think also on the issue of academia and activism, this is Nadje has been working on it for a very long time, and how to bridge the gap between academia and activism, and this is quite important, and particularly for this time, we need this kind of collaboration in order to understand, as I said before, the predicted solutions from governments will be more depth, which means more austerity measures and more public cuts on these services, which means that we need to prepare ourselves to how we really need to deal with the new situation, and taking an opportunity that we do have now some virtual spaces when we can meet. On the issue of practicalities, I think one issue for us, particularly those who live in the West, we need to take this as an opportunity to pressure international organizations who put conditionality of funds on organizations. Now it's not the time to kind of impose certain ideas on certain NGOs, and regardless of the context, and regardless of the history, and regardless of the politics, and how the COVID impacting the whole situation. The conditionality of funding, for example, right now is one of the major issues in relation to unemployment in Palestine, for example. The conditionality, most Palestinian organizations are obliged, for example, to sign anti-terrorism declaration. But anti-terrorism declaration in the context of Palestine is completely different, because in 1 year, the Israeli forces could arrest thousands of people, all those thousands of people, based on the, for example, this declaration of act would not be eligible to work with NGOs. They will not be eligible for their services. And this has put the NGOs in a very, very difficult situation. So maybe this is a time to work and campaign against this conditionality of funding, not only in anti-terrorism declaration in the context of Palestine, but in every context. The time now to prioritize based on the local needs, and based on women's need, and based also on women coming together and making a feminist agenda for tackling and addressing the impacts of COVID on women and migrant workers, and on domestic workers, and on those who are more marginalized in the society.
Thank you, Afaf. Thank you, all of you. As we're coming to a close, I mean, it's obvious that you know, we could have a long debate. I'm happy that there was some tension, because I mean, often, you know, you have events and everyone agrees. It's great if people don't exactly agree, so that sort of opens up interesting spaces. And I think for me, what I'm taking away lots of things, but I guess sort of the main points for me is first, you know, this stress of, okay, we need to historicize. Yes, there are specific impacts that COVID-19 is bringing to specific contexts, but these need to be contextualized in a much broader picture. And historically, of course, when we look at, on the one hand, specifically women's employment and labor force participation, but more broadly, inequalities, clearly there is a very specific trajectory. What we've seen across the globe is that these different inequalities have been starkened in most cases. I think that is also the case in the region. However, there are differences linked to the specific political economies, but also I think very importantly, I mean, that I think was quite evident to me as we're talking, we're sort of right now in the moment of commemorating, thinking about, reflecting on 10 years of uprisings in the region. And clearly countries are in sort of different stages of this ongoing process, and also, different sort of moments of mobilization. And with mobilization, I would say also, moments of hope as opposed to kind of deflation. I think there are huge differences across the countries. And then, another important point, of course, the multiple crises that people are facing in each context. And so, whether it is in terms of severe economic crisis, political corruption, authoritarianism, conflict, wars, displacement, I mean, you name it. And then, the importance to, while recognizing the gendered impact of the pandemic on labor force participation, to then dig deeper and look at the way how, obviously, I think the most obvious examples linked to domestic labor, but we know that also in terms of ethnic and religious minorities, class, I mean, this all, of course, play an important role. So I mean, and I would say, maybe adding to that, the specific politics of gender in each country that are constituted both by states, governments, but also in terms of the feminist mobilization and the kind of wider prevailing gender norms and the contestation of gender norms are really important in trying to understand the broader picture. So I'd like to thank you all and hand over to Banu to say a few last words and conclude this event.
Thank you, Nadje, and thank you again to all the panelists. It was such an informative discussion for me to think about what is the ways in which each of you have a different analytic entry point for the conversation on the pandemic, given your context. And even if we say transnational feminism, the local context looks quite different, even within the ways in which we say mobilization and think about austerity, neoliberalism, and the ways in which authoritarian regimes have used opportunities to continue to sediment their power. So I'm really appreciative of the ways in which you've engaged from your analytic perspective, the ways you're seeing gender and employment come together or not, and at the end of it, what is possible. So I would love to invite everyone, especially our panelists, to contribute their thought pieces or provocations to gender work and organization. We have a section called Feminist Frontiers where we, Hanya, to your point, publish within a month to really continue engaging these conversations, given the urgency of these issues and the fact that we can try to bridge academia and activism in ways that maybe help all of us together as we continue to do better for each of our societies and our neighborhoods and communities. So I want to say thank you so much for sharing your time, wisdom, and insights with us today, and the provocations you've definitely have allowed us to think further on these issues. So in much appreciation from all of you, and we do hope that we'll be able to come to some of the other sessions that we're putting together through CMES and some of it through the work with GWO. So thank you so much to everyone, and we look forward to seeing you again.
Thank you very much.
Thank you, everyone.
Thank you.
Have a
Thank you so much.
weekend. Bye.
Bye.